Welcome back to LMU History Department's summer web social media series, Viral Histories. Viral Histories is an online version of our regular History in the Headlines events, a series of conversations about a variety of issues related to health and disease in response to the current COVID situation. For today's episode, Black Health Matters, I'm joined today by my colleague from the Department of African American Studies, Professor Marne Campbell, a historian of Black Los Angeles, and more generally someone who works on urban history, religious history, African American history, and all of this in the 19th and 20th century United States. Her book, Making Black Los Angeles, Gender, Class, and Community, 1850 to 1917, explores issues of labor, politics, and culture, and incorporates her extensive database of Black communities in Los Angeles. Thanks for joining me today, Marne.
Thanks for having me, Elizabeth.
So we know that COVID-19 is disproportionately affecting Black and Brown communities. It's thus a pandemic that exists within the broader pandemic of structural and systemic racism. Can you talk to us about how the history of slavery and Jim Crow has shaped the history of Black health?
Yeah, so, I think the first thing to think about is the fact that Black people have never really been considered human from the beginning, right? And we see that in the entire history of slavery and in Jim Crow, the era of segregation. So that during slavery, Black people, enslaved people were denied health care. We know that there weren't a lot of doctors, very, very few doctors in the South, and those who were available were not there to treat enslaved people. We know that oftentimes the mistress of the household was the one responsible for the health of the enslaved, and by no means were they trained in healthcare, right? And so there was very little healthcare provided to enslaved Africans, except for by other enslaved Africans or mistresses. And I don't want to make it all seem like they're all big plantations, but in every household that had slaves, right? So the wife of the slaveholder. And this carries into the Jim Crow era as when there is more healthcare that comes about, Black people are still denied. And even when there are doctors that are available, Black people were segregated from coming to doctor visits at certain times. They were also limited as to where they could get medical attention. So that's one part of that. And then the other part is the experimentation that does occur on Black bodies. And so we have a series of examples that range from during slavery, experimentations on African Americans and enslaved Africans, all the way through the era of segregation, where Black people had been used in different kinds of experiments. And I think we'll probably talk about that later in the conversation.
Yeah, well, I'm wondering if you can maybe expand on it now, because there is this history of the medical community exploiting the power hierarchies to take advantage of Black Americans. And so you've alluded to some of these experiments. I'm thinking also of Marion Sims's surgeries on enslaved women, the Tuskegee syphilis experiments, which are perhaps the most famous one, also the Henrietta Lacks episode. So can you talk about some of these experiments and some of their longer term implications, really, for the relationship between Black Americans and the medical profession?
Right. And so, this is really interesting to me because for the last few years, when I'm talking to students about sort of stereotypes, right, about African Americans, they're always saying things like African Americans don't feel as much pain as white people. They have a higher tolerance for pain. They have, they're susceptible to certain diseases and things like that. And all of these things stem from these longer historical experimentations that have been used and done on African Americans so that it could advance the careers of of these white researchers, right? So Marion Sims is one that comes to mind, and all of these gynecological tests that were run on Black women, tests run without anesthesia, tests run to see whether African-American women or enslaved women had similar reproductive organs as white women, only to find out, surprise, they do, because, well, they're all women, right? Things like that, or looking at African Americans genetically, looking at whether they're prone to certain diseases. And the Tuskegee case is really interesting to me because in this sense, African American men were injected with syphilis and then used as experiments in all kinds of ways to learn more about the disease, more so than to learn about treating the disease. And so it became this, this sort of stereotype of Black men in the early and middle of 20th century, but then also it's a stereotype now that people in the medical profession use to talk to and about Black people, so that they say that Black people are more susceptible to, sexually transmitted infections, though syphilis has, it has treatment and things like that. There are others that they will say Black people are more susceptible to, just because they're Black, not because of the ways in which they may practice, their own sexuality and things like that. And so these cases have gone on now for so many years. I mean, we're looking at over 150 years now of testing on African Americans that only advance the medical profession as a whole, but it also then leaves people. So right now, in the beginning of the 21st century, students who are in college, who are going, preparing to go to med school, thinking about African Americans being susceptible to, and then you fill in the blank with all of these things that people have been studying for this long.
That's really interesting, because it strikes me that there are so many longer term implications. The one that you are focusing on here about the ways that those stereotypes get really built into our assumptions about African Americans and about Black health and Black bodies, and how much that colors then the understandings and approaches of medical professions and professionals and people going into healthcare. It also, I think, has to create this sort of very strong history of distrust among Black Americans towards the medical profession. And, we might not see those kinds of same experiments anymore so much. I hope that we're not. But it does still seem to me that medical education and medical research continues to marginalize Black bodies. So perhaps if it doesn't exploit them in the same way, it does marginalize them. And I'm not talking so much about the underrepresentation of Black people in the medical professions, although there is certainly that. I'm talking about how medical education, how medical research assumes white bodies. For that matter, also assumes male bodies. So is based kind of on a white male body.
Yeah, it is, and therefore the treatment that that African Americans get is completely different, and it's almost like they're made to feel ashamed of being Black, right? So that if you go to a doctor and maybe, I'm trying really hard not to stereotype, right? So if you go to a doctor and you have a different body type, then that is a personal choice / problem. You eat the wrong things. And I know that a lot of med school books, and I've had this conversation with a colleague of ours in Health and Human Sciences that talks about the way that med students learn about nutrition, and it's all stereotypical, right? So then it becomes, well, your problem is you are maybe overweight, and you might not be overweight. It might be a muscle mass issue. It might be a whole host of things, but no, you eat too much fried chicken, or you eat too much of the wrong unhealthy, too much fast food, those kinds of things, which it's not just about body weight, but that then implies things for diabetes, for heart disease, all kinds of other problems. And it's all based on sort of this one type of body that is the accepted sort of, if it's not this standard, then there's something wrong. And that then makes people not want to come, not want to go to seek medical attention, or it then also puts a lot of drugs into a person's body, right, by prescription. So if it's the diabetes or if it's the heart disease or whatever it is, without sort of looking for other methods, perhaps, and maybe it's too late because people haven't gone to the doctor, that things get worse and worse. And now you end up taking a lot of medication that may or may not be helpful to you, to your overall health. Mm-hmm. But is seen as like, okay, well, this is what we know helps heart disease, so let's give this to you. There are no prescriptions for, we're going to have you work with a nutritionist, we're going to have you work with a health specialist, exercise and diet and those kinds of things. At this point, it's too late. Mm-hmm. And so nobody wants to go to anyone. Nobody wants to go to a doctor and then just be told that everything they're doing is wrong and this is why they're going to die. Everybody wants to know how they can be better. You go to a doctor not because you want bad news, because you want to know how you can feel better. Mm-hmm. And that doesn't always translate into the Black community.
You mentioned, just as a sort of couple of shout outs to other people, you mentioned our colleague in Health and Human Sciences, that's Professor Heather Tarleton, who works on many of these issues. And then also I'm thinking of our former student, Lash Nolan, who yes. is at Harvard Medical School now and president of the student body there, and who has spoken powerfully about the need for medical education to really integrate studies of history and sociology, and so that it can grapple much more directly with the history of racism and how that shapes healthcare. And she's going to go on and do phenomenal work. So when we look at health today and issues of health and wellness, what are some of the markers that we can look to when trying to identify how racism has negatively affected Black health, and how that legacy and continued reality of structural racism has affected and shaped Black health?
Well, I think we need to really focus on how Black health is treated in our world, and that's our media, our social media, everywhere. So what are the things that people are saying about Black people, and what are they saying are the causes of certain problems, right? So we know that the most appropriate thing to kind of say, to talk about right now, the most the most recent is the COVID-19 pandemic, right? So I watch a lot of news and they say, oh, well, Black people are amongst the highest, they're the highest of the death rate, Latinx people are also amongst the highest. And then it's sort of left there, right? And so we need to kind of look and ask why that is. And when we start to see that, when we start to ask those questions, we see that where are these groups of people located? Where are they located in the country? Where are they located in terms of their connection to healthcare, right? Are they in places where they're likely to have more access to healthcare, less access, and what kind of healthcare? So that's one thing. Then we can start to understand. Another thing I really want to I want to tie in is that race and class are inextricably linked. We cannot separate the two. So where there are class differences in treatment and access to healthcare, there are also racial differences. And so because of those issues, I think we can start to kind of tear down some of the misconceptions and look at how do we identify what's going on and what the problems are. If we say that everybody has to shut down in the country or in certain cities, but then we say, but we need our essential workers. Well, who are our essential workers? You know, they are largely Black and brown people. And if we say, well, we still want to eat our meat, and then we look at the industries that are in, you know, meat packing and all of that. Who are those people who work in these factories? They're largely Black and brown people. And in some cases, there are good numbers of working class white people along with them. But in most cases, we find Black and brown people. And those are the people who, aside from the doctors and nurses, which were always saying, hey, great, you're on the front lines, these people are also on the front lines. We're on the front lines to make sure that everybody is fed. We're on the front lines to make sure that everybody has access to the things they need to survive, not just, you know, the medical professionals. And so it's time that we start to kind of bring that into consideration as well. And then we also look to our current healthcare debate and look at who is entitled to healthcare, who can afford healthcare, what jobs allow people to have healthcare, and allow them the time to go and get the healthcare, to seek the healthcare, the proper healthcare they need when they need it, to make sure that it's affordable. And then on the other side, you have to make sure that the doctors and the medical professionals are treating these communities in the way that they should, rather than treating them as if it's their own fault.
And what you're saying here about essential workers in the context of COVID strikes me as just so important. I remember seeing a press conference, and I think it was Dr. Fauci who was speaking and talking about the disproportionate effects of COVID-19 on Black and brown communities, but then sort of seemed to imply that this was about personal health behaviors, right? And put it down to the level of personal responsibility, rather than really to stress the structural factors that have that mean that sometimes these communities, Black, Indigenous, people of color, but also poor white communities, have more underlying health issues for a variety of reasons, but also then this very important point that Black and brown communities are really at the forefront of continuing to keep the country working as much as possible, even in this kind of situation of shutdown. They don't have the luxury of being able to work from home. They're the bus drivers, the subway workers, the food service providers, the custodial staff, right, who are cleaning those hospitals and cleaning all these spaces. And that just, I think, is such an important story of COVID-19 right now.
Yeah, and here's another thing. I know that initially they were talking about when dealing with COVID, a lot of media outlets were talking about Black and brown people, Indigenous people, and they were saying things like, it's tied to all of these other underlying conditions, right? Heart disease and this and that. And while I'm not a healthcare professional, I'm not an expert in that area, and I understand what they're saying. But at the same time, when you go into a Black community, and I live in a Black community, predominantly Black community, you see Black people out there exercising, running up and down hills, lifting weights. You see them doing all kinds of things that are beneficial to their personal health care, right? See people of color, of all different backgrounds, doing things that are good for their personal health. And they're maintaining this during this time of COVID. So it's a misunderstanding of where the Black community is. And it's also a neglect of the Black community in that no one has gone, not no one, but they do not go and look in the Black community and interact in the Black community. So if you live in a upper middle class area and there's a hospital there and you see all of these people of color being brought in from who live in other communities, you don't know that if you go in the community, the majority of the community, you'll see them out walking, they're jogging, they're riding their bikes, they're doing all kinds of things that are beneficial, right? But instead, it's the few that you come across. You know, you live in a large city like New York, for example, that's very pedestrian friendly, and you see a lot of people, you're used to seeing a lot of white people walking, you know, and you're in, maybe it's Manhattan, but you haven't gone, you know, up to Harlem necessarily, or you haven't gone out to any of the other boroughs where you see more people of color, right? Same thing in Los Angeles. If you're on the West Side, you're less likely to see the people of color, but if you just go a little bit further east, a little bit further south, you'll see a lot more Black people doing the same thing that white people are doing on the West Side, you know?
Yeah, no, I think, yeah, definitely. So, as I mentioned at the beginning, this is sort of a, you know, a pandemic within a longer pandemic, that is the pandemic of American history. But COVID-19 is also intersecting with a very specific moment in history, in the history of racism and how we think about police violence in particular. And I'm wondering how we might look at police violence and perhaps gun violence more generally as public health issues.
Yeah.
In general, but specifically for Black Americans, and police violence specifically as a public health issue for Black Americans.
Yeah, I mean, you know, again, you attach it to the same long history of stereotyping these different groups of people. So for African Americans, it's the criminalization of African Americans, which begins, you know, obviously begins during slavery. It's carried over into the Jim Crow era, and it's it really becomes I don't want to say, I'm trying to really be careful about my words, but criminalization is really developing and reaching new heights in the 1920s, 1930s, and so forth. And you have a growing prison population, et cetera, all the way through the 20th century. And this is all tied to the same treatment of African Americans. African Americans are, and these are stereotypes, stronger, right, than white people, so they need to be dealt with a certain kind of way. So you use more force. They talk about African Americans, particularly African American men, as being more brutal, less human than white men. And the stereotypes that begin about, you know, Black men chasing after white women who need to be protected, and all of these things start these uses of force against African Americans, and even during slavery, we see this, right, with really harsh punishments of Black men and women. And so so what happens is that just carries over. It carries over from decade to decade, and now century to century, where Black people are dealt with a lot more force by police, by vigilantes, etc. And that is a public health issue, because we're creating a slow genocide. Sometimes it's not so slow, of Black people. And if we're not killing, if they are not being killed, they are being severely injured, which is also an issue of public health. And it's all kinds of public issues, right? So you have the health side of it. You also have the social side of it, where you have people who are no longer there for their families, children are without their fathers, mothers are without their sons, people are without their brothers, their sisters, their moms. And so it creates more of a need. That's one less person in the household that is there to help take care of and nurture whomever it is in the family that they take care of, that they're responsible for. And so that then causes a draw on other public services that are available in both in the health profession and in the social sector of the communities. But this injuring of and great bodily harm to and killing of Black people should be considered in and of itself a public health issue. Gun violence should be considered and is in certain circles considered a public health issue, and it needs to be taken much more seriously than it ever has been, because more and more people are dying because of all of that.
Do you have any hope, maybe if I can use that word, that the protests that are happening right now are creating a moment where we might look at these issues to a much greater extent than we have before? And I mean in a sustained way, not just as a kind of temporary blip that goes away.
Right, I do. I think that that the way people are talking about the issues now and the way people are contextualizing their own protests in the center, at the center of all of this, is much more sustainable, I believe. And I think that it's much more, it provides much more background for people to understand what is happening and why things are happening. Now, I'm not dismissing what happened in the 60s and 70s, because I feel like those protests were very much contextualized a lot of times in the right kind of way. They were very, very well put together and very well informed, very much informed. But I connect a lot of times the Black Lives Matter movement to the Black Power movement, the Black Panther movement, in that they had these platforms that were reasonable. They were very much about, this is where we are as Black people in this country, and this is how we can balance this out and make it much more equitable for Black people. I look at Black Lives Matter today as a very misunderstood movement. I look at the when the organization was founded, the women had a very well put together website that kind of explained every issue that Black people faced in the country and why that needed to be addressed. So from healthcare to, education, homelessness, it's much bigger than ending police violence, mm-hmm. right? And so, I think that the platform has expanded, but the platform has expanded in the fight for Black lives generally, has expanded to kind of let people know that this is not just a few, quote unquote, radical African Americans who want to, fight for certain things. This is a much broader, much longer systemic issue that needs to be addressed, and here's how we can address it. And so I think that is wonderful. I think that helps. But I also think our use of social media these days is much more appropriate for letting people see and understand really what's going on. So we all have cell phones. A lot of those are smartphones, so people are recording things that are going on. You cannot deny what is happening. And I think that is the biggest change and the biggest sort of marker for hope that we have right now.
Great. Well, thank you so much, Marne, for taking time out of your summer to come speak with us. I really appreciate it. And
Well, thank you
thanks
for
to all
having
of
me.
you, sorry. And thanks to all of you for tuning in. I hope you'll come back next week when we will take a look at Asia and East Asian perspectives on COVID. Thanks again, Marnie.
Thank you.